Hi, welcome or welcome back to my channel. This is Tammy bringing the tea of the day, Tammy's Tea. We're going to be discussing how I chose the hospital to receive my treatment, my doctors, the actual treatment that I received, and the treatment side effects. So let's get into it. I currently live in the Houston, Texas area. And I received my original diagnosis at Memorial Hermann, where my general family doctor is. And she referred me to a medical oncologist inside the Memorial Hermann hospital. So I did see her referral, and that medical oncologist referred me to a surgical breast surgeon oncologist, and that person referred me to another oncologist, so on and so forth. Within Memorial Hermann sector, you have to generally find your own doctors, put together your own team of doctors. They were really concerned about my situation. They was ready to get started, but I want to take a little more time to really search out more doctors. So I seen other oncologists were still want to treat my breast cancer, metastatic breast cancer, HER2 positive, to give me the exact same treatment plan. And I also went seen a medical oncologist at MD Anderson. And when I got to MD Anderson, they were absolutely wonderful. On my first visit with them, they gave me things to take home to read, to study, and I really liked them because they left me with something that I thought was tangible, that I could take home and continue my my own research. So they gave me this first visit guide it had a lot of information as far as your care team, the 4 steps of your initial visits, what to expect, tips in getting around, your clinical trials, your treatment decisions, just so many things that I really need to know that some of the other doctors, oncologists didn't fill me in. They talked to me about my treatment, but my main reason for seeing several doctors is I wanted the whole package. MD Anderson pretty much gave me the entire package that I was looking for. Not only did they give me a first visit guide, they also gave me a chemotherapy guide. And in this guide, is just basic information, side effects, home care, sexual infertility, and other resources. So they were really equipped with caring for the entire patient, mind, body, and spirit. And as well as they set you up with a mind chart. In the mind chart, you can contact your team of doctors at any time you have any questions, because a lot of times you don't have all the questions memorized, or you don't come up with everything that you need to ask your doctor. You always have questions that you need to ask when you're at home, or you forget once you get to the doctor. If you didn't write it down, if you didn't make some type of memo, you can contact your doctor or any of the team at any time through my chart. Nevertheless, I did choose MD Anderson. So my main reason for choosing them is because MD Anderson they put my team of doctors together. I didn't have to go out and research and find all kind of people and do the backgrounds and on the doctors and see what if they have any malpractice suit. With other establishments, other hospitals, I had to put together my own team. And when I say team, I mean your medical oncologist, your surgical oncologist, your breast reconstruction oncologist. If you need that, you need a radiation oncologist.
Ain't nobody got time for that.
MD Anderson, and they pretty much took that extra stress and pressure off me. Another reason why I chose MD Anderson, they was transparent with fees, actually what you pay, what the insurance pay, everything was open to you, so it was exposed to you in your My Chart. The treatment that I actually received have 6 rounds of chemotherapy treatment, 21 days apart. They called it TCHP, which was a cocktail. So it was Taxotere, carboplatin, Herceptin, and Perjeta. So each one of these medications, they gave it to me in a IV drip. So prior to starting my treatment, I had to go in and have a outpatient surgery where they placed a IV port into my chest. So this is where they placed the port here, and the port has a tube that goes up, and I have another little small scar here. The tube of this port goes up here and it drops down into my heart. So when I go in to receive my treatment, they put the IV needle into the port. It's a little round open hole, and I'll place a picture of what the port looks like. Prior to receiving my treatment, I go in and I have my blood drawn. So they check your blood every time before receiving treatment. The first time I went in and received my treatment, it was 6 hours long. So I took plenty of snack, some reading material, complete my chemo treatment, and then I will have my surgery. And my surgery would happen 4 weeks after my last chemo treatment. And with that surgery, my option was to have a lumpectomy, a single mastectomy, or a bilateral mastectomy. And I chose to have the bilateral mastectomy. And after my surgery, I will then move into either the same day immediately radiation therapy. So I've already seen my radiation therapist, and they let me know, oncologist, my radiation oncologist, and they let me know I would have to do 5 days a week for 6 weeks. Wow, that's gonna be a lot. And that's going back and forth over there every day, 5 days a week for 6 weeks. And after I finished with radiation therapy, I would be able to have reconstructive surgery. So after everything has been completed, I will still be on a chemotherapy medication for a year, but my hair will be able to grow back during that time. So yeah, I can't wait to move into the next phase. I'm still in phase 1. I'm ready for phase 2, which is breast surgery. Preferably come through that just fine. Taxotere and the carboplatin are the 2 that will cause you to lose your hair. I was going through this phase. I wanted to save my hair. So I tried the cool capping, the ice capping method. And I'm gonna place a picture. That was one of the devastating things that I was afraid of, losing my hair. Freezing your scalp. If you freeze your scalp and your follicles, the body won't pump blood to the area. So what the carboplatin does, it kills all rapidly dividing cells. Cancer is a rapidly dividing cell. Hair follicles has rapidly dividing cells. So it can distinguish good cells and bad cells. Freezing your follicles on your scalp keeps the blood from flowing in that area, and so it kind of skips over those rapidly dividing cells. After doing a little more research, I found out that metastatic breast cancer likes to move to your brain. Brain cancer? I didn't find anything that linking cool capping to brain cancer. Since I was going through chemotherapy, and I want everything to work like it's supposed to work. Let me just get Tammy out the way and not worry about hair, because hair will grow back. So I discontinued the cool capping. I'm just gonna let this treatment do its job. My first treatment was 6 hours. My second treatment, that's like 4.5 hours. My third treatment, I think my third and fourth treatment was also about 4 hours. Each and every treatment has been different from the last. I got a new set of side effects from the last. Each one of them added a little something that the last one didn't have. Yes, some of the last one carried over, but I got a new side effect each time. So the side effects is just, they go on and on and on. Okay, the major side effect, hair loss. For me, that was the most. Then bone pain, a lot of back pains, headaches, nasal drip, nose constantly running, mouth, gums bleed. They told me I'd probably get canker sores or little ulcers or something like that in your mouth. I didn't get in. I'm not having any of those. Some hearing loss, your skin bruising, very, very easy. Complexion changes. I haven't had too much changes, just on my hands. It's got darker, and then I got this ring, this darkness all around my hands, even on the inside of the palm of my hands is darker. Another side effect, nausea, vomiting, diarrhea. I've had diarrhea, something fierce, and I just really stay on my regimen of taking my Imodium. They go on and on and on. And fatigue, oh my God, and you totally tired. It's like you can barely pull yourself away from the bed. You can barely move. But I push myself. I'm just not a person that gives in to sickness and want to be sick. So I just make myself go. I just keep going. And in this guide, it gives you everything for like diarrhea. Let's tell you, take Imodium. A lot of the things is just over-the-counter medication to combat some of the side effects. For indigestion, oh yeah, I got indigestion real bad. I never had heartburn before, so they just told me to take some Pepsid. It as long as you stay ahead of your side effects and stay on a good regimen and taking the medication prior to the side effects actually taking place. In nails, your fingernails and toenails will lift from your nail bed. I can't stand to look at my nails. They are dark underneath. I mean, when a peach part is dark, it's gray. You're not supposed to use any acrylic nails or anything with acetone to remove dip powder or the gel polishes. So just I have a lot of white spots where you can see that they left from the nail bed. It looks horrible. I cannot look at it, so I have to put nail polish to keep from looking at it. They said the nail can totally come off. I haven't experienced any of that. Anything that's total lifting. I still have 2 more treatments to go. I don't know if I'll lose a nail or not within the next couple of treatments. Another thing, insomnia, hot flashes. If you are not premenopause or in menopause, it will bring on all of the menopausal side effects. Hot flashes. Oh my God, they are miserable. It's so many side effects. And you don't have all of the side effects. There's some things you may experience that I may have some that you may not have, or you may experience something that I may not have. But the runny nose, that's awful, because it constantly runs. It's so light, it's runny like almost like water, that you really have to catch it because it just come down. So you have to, and it's not like a cold. Colds are a side effect, and it's because your immune system is really low. Your blood count is low because the chemo is killing all your red blood cells and your white blood cells. So you need to pretty much not being in any social environments, because it's so easy to get sick and pick up things from other people. And by the fact that we're in COVID-19, this is a pre-existing condition. So I have to be very, very careful socializing and being around so many people. Heart palpitations. My heart was just beating off rhythm. It was just like it was pounding out of my chest. So I did have to go back to the hospital and see a cardiologist. So I had to have an EKG, and they found that my heart rhythm was through the roof. All depending on how I lean over or do something, I can hear in my right ear, I can hear my heartbeat. I didn't like that. So yeah, I went back to see my doctor, and he gave me some medication. And it's been fine ever since. Oh, another side effect, my taste buds. My food tastes horrible. Nothing I ate tastes good. Taste sweets, but I can't taste salt. No food had any flavoring. Gave me a metallic taste. All my food tastes like I was eating metal. I had a real strong presence of metal. So, and chew gum on a regular. Chewing gum. Just chew it. Keep your taste buds engaged, and kind of spit it out and put another fresh piece. Keep doing that all day long, and then they suck on hard candies. Keep your taste bud engaged. So when you did have food, you can taste some flavor, and you can have. It didn't work. Food still tastes horrible. Nothing tastes great anyway, but drinking a lot of water immediately after chemo helps to flush the chemo out of your body. You want it to go in and do its job, but not hang around so long. That's all I have. Glory be to God, and peace be unto you. Bye-bye.